Some major changes are now underway affecting SNAP and Medicaid, and if you or someone you know receives Social Security benefits, whether it's SSI, SSDI, retirement, survivor, or spousal, this directly concerns you. Why? Because over 50 million Social Security recipients are also eligible for either Medicaid, food assistance through SNAP, or both. These two safety net programs, serving nearly 100 million Americans, are facing the biggest structural overhaul in modern history, and the changes are being implemented right now. You might not have heard much about it, but I want to walk you through exactly what's changing, what it means for you, and why this could affect your access to healthcare, food, and even future COLA adjustments. Let's talk about SNAP, also known as food stamps or EBT. Approximately 42 million people rely on SNAP, including many low-income seniors, people with disabilities, and those receiving SSI or SSDI. Under the new legislation just passed, SNAP will see a $295 billion reduction in spending over the next 10 years. That's not speculation. That's straight from the Congressional Budget Office and confirmed by multiple sources like the LA Times and Associated Press. As a result, about 3.2 million current recipients will be dropped from the SNAP program entirely. That drops participation down to around 39 million, meaning a significant cut to a program that helps many low-income Social Security recipients put food on the table each month. But here's what's really important. One of the biggest changes is to work requirements. Previously, able-bodied adults without dependents between ages 18 and 49 had to meet a work requirement. That's now been expanded to include adults up to age 64. If you're between the ages of 18 and 64 and you don't have a disability and you don't have a qualifying dependent, you must now complete at least 80 hours per month in work, job training, or approved volunteering activities to remain eligible for SNAP. This impacts countless older adults and near retirees who are not yet eligible for full retirement benefits but still rely on food assistance while receiving early or reduced Social Security. Now, here's where definitions matter a lot. Under these new rules, the definition of a dependent for SNAP purposes has been narrowed. It used to be that having a child under 18 could exempt you from work requirements. That has now changed. Only children under the age of 7 now qualify as dependents when evaluating exemptions. So if you're caring for a child who is 7, 10, or even 15, you are no longer exempt from work rules under SNAP. For those on Medicaid, similar changes are happening. Medicaid covers roughly 71 to 72 million Americans, including millions of low-income retirees and people receiving SSDI and SSI. The new work requirements for Medicaid will apply to able-bodied adults without dependents between the ages of 19 and 64. So if you're on SSDI or have a documented disability, you're exempt. But if you're a near-retirement adult who is not considered disabled under federal guidelines and don't have a dependent, you'll be expected to meet the new activity requirements or risk losing coverage. The dependent cutoff age for Medicaid is also changing. Unlike SNAP, where dependents must now be under 7, for Medicaid it's under 14, so if you're a parent of a 14-year-old and you thought that qualified you as exempt from work requirements, under the new rules, you're not. Again, this redefinition of dependents is going to catch millions of people by surprise. Now, here's another critical issue. It's projected that about 10 million people could lose Medicaid coverage because of these changes. That's not speculation either. That's coming from recent estimates by the Congressional Budget Office and health policy analysts. We're going from about 72 million participants to potentially just over 61 million in the near term. For many low-income Social Security recipients who rely on Medicaid to supplement or replace Medicare coverage, especially those who can't afford Medicare Part B premiums, this is going to be a serious issue, and it doesn't stop there. Another new rule introduces a $35 copay on certain Medicaid services. Currently, most Medicaid users pay nothing or maybe a token $1 to $3 copay. But this new $35 charge could apply to specialist visits, outpatient services, and some prescriptions, depending on the state. For someone living on a fixed income, let's say you're on SSI and receive only $943 a month, that $35 hits hard. Here's why Social Security beneficiaries must care about all of this. These changes reduce access to two programs that are often vital companions to Social Security: food and medical assistance. And while these changes don't directly alter Social Security's benefit formula, they indirectly reduce the effectiveness of your monthly benefit. If you're spending more out of pocket for food or healthcare, your fixed income stretches less. In other words, it's an erosion of real world value. And there's more. Because SNAP benefits receive a cost of living adjustment, COLA, each year, just like Social Security, there's another hidden cut buried in this legislation. The annual COLA for SNAP will now be capped, saving the government an estimated $35 billion over 10 years. So even if food prices continue to rise, SNAP will no longer fully keep up, just like how some argue Social Security's COLA doesn't reflect seniors' real expenses. Again, this means less purchasing power for those who already have the least margin to spare. Let's put this together. If you're receiving Social Security and also enrolled in SNAP or Medicaid, your monthly life just got more expensive. You may have to meet new work requirements, you might lose eligibility, and even if you remain eligible, your benefits may not stretch as far. There's real concern among advocacy groups and policy analysts that these changes will disproportionately impact seniors, the disabled, and low income workers, people who often depend on Social Security as their main or only source of income. Many are asking if this could lead to a domino effect. If Medicaid rolls shrink and fewer people qualify for food stamps, we may see a heavier reliance on Social Security, creating more pressure on a system already under fiscal strain. Some are even speculating that this could eventually lead to new attempts to reform or restrict Social Security access or eligibility to compensate. That's speculative for now, but history has shown us that when safety net programs are cut, lawmakers often turn next to Social Security. Even though Social Security itself is not directly being cut or overhauled under this legislation, it's essential to understand how these surrounding program changes can ripple across and affect beneficiaries in a meaningful way. For example, many low-income Social Security recipients also rely on SNAP to cover food costs or Medicaid to access critical medical care. So when eligibility rules shift, or work requirements tighten, or dependent definitions change, these seemingly external changes can suddenly create financial pressure for seniors, disabled individuals, and families who live on fixed Social Security payments. Let's not forget, Social Security checks are not keeping up with the actual inflation most Americans experience. A $943 SSI benefit or a $1,400 SSDI check doesn't stretch nearly as far in 2025 as it did just a few years ago. And if someone loses SNAP support or has to pay $35, copays on medical visits that used to be free under Medicaid, that loss feels like a direct Social Security cut, even if technically the check amount stays the same. What makes this even more concerning is how fast these changes are being implemented. Many recipients are only going to find out when they suddenly lose coverage or get denied during their next redetermination. By then, it might be too late to fix the issue in time to avoid a gap in food or healthcare support. That's why now, more than ever, it's crucial